Let's also talk about, well, the last time we had an interaction, you spoke about the Agenda 111 project there. Sure. Is there any update? Is there any work happening on the ground?
It's at the footing stage. I think they are now filling what the contractors will describe as footing level. So maybe they will cast the appropriate concrete and start raising the block. So I do pray and hope that the contractor will continue the pace he has begun and maybe quicken it when we cross the filling stage for us to see the project completed. And that's all our prayer.
So that's your prayer. Is it something at least then? Is it something at least then? Looking at, we'll get to the La General Hospital later, but at least in your constituency, Agenda 111 has taken off. If this administration, the president has promised that by the end of his tenure, these projects would have been completed. Is it then something you want to applaud this government for?
Well, the reason such investments are good, but then if a government tells you and the leader tells you that it has to take a disaster like COVID to give him that shock to want to see investment in the healthcare delivery, then I was wondering what type of leader we had. Because even without COVID, the person you took over from was investing heavily in healthcare delivery, building hospitals, huge ones, to make sure that our health needs are met. Only for you to abandon all these projects. And then we got confronted with COVID. But for the facilities built by the previous administration under John Dramani Mahama and late Professor J.E.A. Mills would have been found wanting. And that when it comes to health infrastructure, the NDC truly stands very tall. Very, very, very tall. And we know about this. And so I was surprised that instead of continuing, you waited for disaster to strike, for us to suffer, before you realized that you needed to build hospitals. But even the promise that you were going to do them in within 2 years has not been met, because not a single one has seen any completion.